KFI AM 640, Bill Carroll. Prop 46, one of those things we have to make decisions about. And sometimes I think it's possible to be philosophically on side with something, but not think it's a good idea in practice. That might be where I'm leaning on this one. But I'm still, my mind is open a crack, and I thought the best way to handle that is to talk to people from both sides. Try to get to understand it a little better, figure out what the positives are, what the negatives are. Prop 46, it is the Troy and Alana Pack Patient Safety Act. And Robert Pack is the guy who drew it up. And he's on the line right now, and he's going to talk to us about this. But, of course, for every yes side, there is a no side. And the no side makes it sound like this is a very bad idea.
Californians are discovering the real risks behind Prop 46. It was written and paid for by the trial lawyers to make them millions, while for the rest of us, healthcare costs go up. No wonder every major newspaper in the state opposes Prop 46. They say 46 overreached in a decidedly cynical way. It's a ploy for trial lawyers to enrich themselves. And Prop 46 has too many potential drawbacks to be worth the risk. Time to vote no on Prop 46.
All right. I've got Frank Pack here. I thought we were talking to Robert Pack. Is it? Do I have Frank or Robert?
I'm Robert Pack.
Okay. Well, I have Frank on my screen, so I just wanted to be sure because I thought it was going to be Robert that was joining me.
Yeah, and I go by Bob. So you can say Bob if you prefer, if you like.
Okay. So this is your inspiration. Tell us why.
Yes. Well, 10 years ago, my two young children, Troy and Alana, who were ages 10 and 7, were run over and killed by a driver who was a doctor shopper of prescription narcotics. And she had been given hundreds and hundreds of narcotic pills like Vicodin and others from numerous doctors who never checked her and verified that she even had an injury. They never shared a medical file. And they never checked the state's database to see that she was truly a patient in need.
Okay, and how did that impact on you?
Well, so over the years, I've been working on prescription drug abuse through the legislature and in patient safety laws, and I helped develop the drug tracking system, the electronic version, that now is a tool for doctors to check right from their offices. And but some of these issues have been blocked by the medical association, the pharmaceutical industry, and insurance industry at the legislature. So it left me no alternative but to create this ballot measure to help keep patients safe and to help victims who are harmed to be able to get accountability.
Why is it called the Troy and Alana Pack Patient Safety Act?
Well, it's called that because it's named after my two children, Troy and Alana, who were killed 10 years ago. And now it's going by Prop 46, which is on the ballot this coming month.
And do you believe legislation like this would have made a difference for your children?
Well, it absolutely would have saved their lives because the woman who ran over my children was caught and convicted of second-degree murder because she had numerous DUIs for under the influence of prescription narcotics, and the doctors just kept giving it to her. They were feeding her addiction rather than treating her as a real patient. And this drug tracking system, if they would have used that, it would have saved my children's lives.
Right. Well, you've heard what the opponents are saying about it, and that is that, you know, there's no guarantee of privacy with this system, that it's an overreach, that it's too complicated, the current system doesn't work, the whole thing is a mess. Do you believe that it has problems that need to be fixed, or is this a workable system?
Well, I helped develop it and spent years working with it on the Department of Justice. The only thing it needed was some additional funding to accommodate a larger enrollment. There's the actual data collection of the prescriptions. That's been going on since 1997 and is fully safe and compliant for privacy. So I don't know why they're using that as a smokescreen issue. The doctors just need to check the system, and that's what we're putting in the ballot measure. There's nothing more. And as far as the overall proposition, you know, it's all about patients. And the ones who are really fighting this are the insurance companies because they don't want to pay a victim when they're harmed by medical negligence. And that's a 40-year-old law that needs to be updated so patients can get some form of compensation when they're killed or maimed, and accountability. And that's why the insurance industry has put up the $60 million to fight this measure.
Well, but this is where it gets complicated, because parts of this make sense to some and not to others, and you lump the whole thing in together. It does seem like common sense, Bob, that if you allow patients to sue doctors for greater amounts, that insurance companies will have to pay out more, and they will inevitably pass those costs along to everybody else. We're all going to have to pay for those increased costs.
That's not the case, and that's another smoke and mirrors issue by the opponents. You see, 5 states in the last 5 years have their state Supreme Courts have completely overturned, abolished the micro-cap laws in those states. And many of those cap laws have been 500,000, 750,000. Ours is the lowest at 250 in California. And those states, the reason they abolished them is because they found that the insurance companies were getting too rich and their profit margins were too wide, and they weren't passing those savings back to doctors in the form of lower premiums or rebates. And so the conclusion is victims are harmed, they get no compensation and no justice, and insurance companies get richer.
Right, but that's only one part of that argument, Bob, because, okay, great. I'd rather not be harmed than be compensated more. So how does it prevent doctors, how does it make them less likely to harm you? Most doctors, I would think, are not going to say, well, now I better do a good job because I could be sued for a lot more. They're incompetent for a lot of reasons, probably most of them either beyond their control at the time, beyond their abilities and capabilities, or beyond their own maybe even health to manage. So they're going to still make mistakes.
Yeah, and the only measure for a victim is to be fairly compensated. When they get no compensation and the doctor doesn't have to go to court or answer to the harm, they just go on with their same old practice. The hospital doesn't care. They got out of it, and the victim is left suffering. And so if you have accountability, if the doctor or hospital gets stung for a jury lawsuit of $2 million for the value of that child's life or $4 million, they're going to think twice if a doctor keeps doing that. And they're going to change their practices and protocols. They're going to initiate new changes in training. And that's what makes the healthcare industry safer. But without that, without ever having to answer to a medical case, then they just go on their same old ways. What
about drug testing for doctors? Some of them are saying, it's just unfair. I may have, some patient could have died 6 months ago in my clinic, or been the damage could have been done 6 months ago. Now you're going to drug test me to see whether or not it was high 6 months ago. It doesn't make any sense. And you're going to drug test me when I'm on a vacation and I can't use alcohol when I'm on vacation. It overreaches in that area too.
Well, that's not a realistic, those are not realistic scenarios. Look, the transportation industry, the military, and probably more appropriately, pilots, they all are randomly drug tested, and it works perfect in those professions. Pilots, they travel more than anyone. They're gone all the time, and unlike doctors, and it works for them. If they're gone, need to be tested, all they have to do is explain they're gone, and they'll come back at a later point and be tested. These scenarios are unrealistic.
So you're saying it's not true that doctors could be tested while on vacation, and I'm down in Mexico and I've been drinking a lot of pina coladas while I was there.
Yeah, I mean, they're not going to have to run into a local clinic and get tested right there. That's worked out and resolved because it's managed by the medical board. The whole idea to drug testing, and the reason it works in all these industries, is not about catching the doctor right after an adverse event or suspecting. That's not really the intent of the law is deterrence. It creates a deterrent so doctors who are abusing prescription narcotics, which many of them are, is to stop it because they know they're going to get caught and tripped up in a random test. And so the deterrence effect is what lowers the level of abuse in these professions.
Thank you, Bob. Appreciate it.
Yes, thank you very much.
Bob Pack, author of Prop 46. All right. What does the other side say about this? We'll find out in a couple of minutes here. First. Better go faster because it takes time to get through this stuff. KFI AM 640, Bill Carroll, Prop 46. You heard the yes side from the guy who is behind it. It sounds pretty convincing, right? I mean, I'd like to know if my doctor's high or not. And maybe we can stop people from drug shopping by having some kind of database that doctors would be forced to check. And why can't I sue my doctor and make them more accountable? And why wouldn't that maybe make doctors behave a little bit better? It all sounds good.
Insurance companies are spending millions of dollars trying to mislead you about the effects of Proposition 46. Well, here's the truth. 46 will save lives. It will save money, too. I'm Bob Pack, and I'm fighting for Prop 46 because I lost my 2 children to preventable medical errors, and I don't want anyone else to lose theirs. The 3 provisions in 46 will reduce medical errors and protect patients, save money, and save lives. Yes, on 46.
So the big money from lawyers is what that's why we want it. The lawyers want it. No, the insurance companies don't want it. They're putting big money in to say that they don't want it because they don't want to spend money on it. Jason Kinney is a spokesperson for the no Prop 46 side. Thanks for joining us, Jason.
No problem.
It all sounds like it's well-intentioned and a good idea. Why isn't it? Let's start with why doctors can't be held more accountable. Somebody is the victim of malpractice, gets very sick, might need care for a long time. Why can't they sue for what the damage is really worth?
Well, they can sue. The truth is the average micro award has risen 2.5 times the rate of inflation since 1975. But this is not about whether the cap, should or should not be raised. This is really about a money grab by trial attorneys. This is a measure that, by the way, is written by trial lawyers, paid for by trial lawyers, for the benefit of trial lawyers. Everyone else pays the price. I heard the ad with Mr. Pack claiming that Prop 46 is going to save money. That assertion is more deceptive than a Clayton Kershaw curveball. The idea that it's going to save money, this is going to be hundreds of millions of dollars in additional costs through additional lawsuits. The independent, nonpartisan legislative analyst has reviewed this and said that just the cost to state and local governments, which of course gets passed down to taxpayers, is going to be several hundreds of millions of dollars. This is money out of everyone's pocket.
Where does that cost come from? That's not from the lawsuit part.
It comes from a lot. First of all, that estimate comes from the increased cost of the overall system. A lot of it is going to be increased cost of premiums and cost of insurance as a result of this. In every state,
yeah, but that's not all government.
No, it's not all government. You're right. Yeah, the several hundreds of millions of dollars of cost is going to be just to the increase to government. That doesn't include things like school districts. It doesn't include the cost to everyday consumers. An independent analyst looked at this and said the cost to healthcare consumers will be in the billions, an average of about $1,000 in additional healthcare costs for a family of 4.
Part of Bob's part of his argument is in other states where the amount's been raised in suits, the insurance companies were making so much money that they were still profitable and they didn't pass those costs along.
Well, look, it's absolutely wrong. I mean, in every big state where there's either a weak cap or no cap, the premiums are much higher in those big states than they are in California. I mean, micro was a solution, a bipartisan solution in the 70s. A governor and legislature and 5 different governors and 38 different legislatures have reviewed it since, in addition to 10 different courts, and have all come to the conclusion that it strikes a reasonable balance between the finding justice for the aggrieved versus making sure that costs are controlled within the system. And remember, it's only one category of medical malpractice that's capped. Legal costs or medical costs, those are unlimited. Punitive costs are unlimited. It's just this one category of non-economic damages. But,
are you against the idea, not to push you along, Jason, and if you want, I might keep you after the news because I feel like you didn't get as much time as Bob, but
sure.
Are you against the idea in principle of doctors being forced to being able to go online somewhere and look at a database to say, this patient in front of me, man, they've been getting narcotics from every doctor in the state. I'm not giving it to them. That does sound like a good idea.
Of course not. In fact, the medical community has supported the Cures database in principle. They actually pay for the Cures database. The problem with the mandate that's included in this measure is that it requires doctors and pharmacists to consult the database before they can dispense any new medicine to patients. The problem is the database doesn't work in its current form. So this is yet another flaw in the measure, and it underscores the fact that the proponents never really cared about either adding a cures mandate or doing drug testing on doctors. This was always about a gold rush for trial attorneys in terms of medical malpractice suits. The rest of it is flawed. It's sloppy. It doesn't really work. The cures mandate is going to cause chaos within the system. It takes effect the day after the election, and the system as it stands right now, the database, doesn't work. And it won't work for months, according to the Attorney General's office. January 1st or July 1st.
If it did work, would you be against that part of it?
Would we be against the mandate? If it could be proven that the system works and that doctors and pharmacists could get access to this information in a timely fashion, I think everybody embraces it. The problem is, and by the way, there was a legislative deal struck last year on this very topic, but the proponents of this measure decided to run out and decided to add an artificial deadline that can't be met. And as a result, it's going to create chaos.
Well, there's something I didn't know. Can you wait a couple of minutes, come back, and answer the question about drug testing for doctors?
Sure.
All right. Hang on. And if you can't, I could tape his answer to it and play it. But let's give him another couple of minutes on the other side, because the way the clock worked out there, he didn't get as much time as Bob did. I want to ask that one other question. First, KFI AM 640. Bill Carroll. I was doing a little mental math. I might have been off by a minute or two, but it seemed like Bob Pack, who is the author of Prop 46, got a little more time than we'd given to Jason Kinney, who is a spokesperson for the no on 46 side. So I want to get right back to him on the phone. A couple of things I want to address before we go, Jason. One is the idea that despite how the costs get passed along to the ultimate user, which is always going to be you and me through insurance premium increases, would it make doctors and hospitals more accountable, at least, if they had to pay out larger settlements?
Well, no, and in fact, I mean, that's another one of the great misnomers of this. I mean, doctors right now under the current system, physicians, healthcare providers, are accountable. The problem here is, at a time when doctors are more important than ever, we have doctor shortages. Access is an issue. We have to keep costs down in the system to keep our doors open and make sure that every Californian has access to care. There's a reason why every community clinic association in the state, including the Community Clinic Association of Los Angeles County, opposes this measure so strongly. This is going to have a direct negative impact on their ability to serve patients.
What about drug testing, alcohol testing of doctors? I mean, if these people have our lives in our hands, I'd like a sober doctor.
Sure, and I think we can all agree that one doctor with drug or alcohol problems is one too many, but there's a reason why every newspaper in the state, not every major newspaper, not some, every newspaper has reviewed this measure and opposed it, and the drug testing provision is a big reason why. First of all, the proponents admit that they only added drug testing at the last minute because focus groups told them it was the best way to get votes for the thing they really wanted, which was the increase in the number of lawsuits and the attorney's fees. But the bigger one is they just wrote it in a terrible way. It's flawed, it's risky, it's massive healthcare policy that's not implemented in any state in the country. But they wrote it without any input from health experts, medical professionals, or civil liberties groups. There's a reason why ACLU opposes Prop 46. This drug testing provision, as they wrote it, would be the first one in the country for any employee classification that actually requires employees to perform drug tests even when they're off duty. They could be on vacation. They could be having a drink of wine, on their anniversary, and they have to come in. And the testing could be triggered by events that have nothing to do with the physicians themselves. They could have had nothing to do with anything that we're talking about.
Bob Pack says that argument is just BS. The doctor could be on vacation,
wrong, and he should read his own measure with due respect.
Because doctors, let me ask you though. Here's what he said: the doctors, organizations themselves would control it, and they'd simply say, "Oh, you're on vacation. When your vacation's over, come in for a test."
No, that's absolutely not how they wrote it. There is a presumption of negligence if you don't report in a timely fashion your test. You have 12 hours from the time of an adverse event. An adverse event is 24 different classifications.
Yeah, but an adverse event's not going to happen when you're on vacation.
An adverse event could certainly happen when you're on vacation because some of them aren't identified until well after a patient's been released from treatment. And a lot of the adverse
but in that case, a drug test is kind of unrelated, could be totally unrelated. You could be drunk now, but 3 weeks ago when you did this procedure, it's now the adverse effect is now showing up.
If you're out of state on vacation and you don't report within 12 hours, your license is immediately suspended and an investigation takes place. Yeah. There is no exceptions in the measure as they wrote it. Now, after the fact, after they've already turned it in and they're stuck with this measure, they're now claiming that there's all this wiggle room. It's simply not the case. I would suggest that they have their team read their own measure because they're forcing voters to vote up and down on it, and it's going to have dire consequences for our healthcare system.
Thank you, JC.
Thank you, sir.
Appreciate it. Jason Kinney, spokesperson for No on Prop 46. All right, so you've had a chance to hear it, and I got a couple of minutes here if you want to jump in. 800-520-1KFI. Based on what you just heard, I'm hoping you just heard both guys. Where would you lean on it? Not to say there isn't 10 more questions I could have asked of each guy, and there's a lot more detail to it. But I think I've already heard enough to know that there's so much here that there are parts I like and I don't like, and it's just all too much. It is a dog's breakfast as a proposition, as my dad used to say. That's a real dog's breakfast, that. Which meant, in the morning we'd give the dog everything that we didn't eat the night before. So there's a little bit of this and a little bit of that, and there's some steak and there's some mashed potatoes. It's a dog's breakfast. There's too much in here. Separate it out and get back to me. In the meantime, I think the only thing you can do is say no to it. 800-520-1KFI. What do you think? Tony, go ahead. You're on with Bill Carroll.
Hey, Bill, this is Tony from Upland, California, and I heard both gentlemen, too, and the first gentleman, I forgot his name, but when
Bob.
you asked him why he thought this would help, made a difference in his life, and he went on to talk about what he's done for the last 10 years, and then you finally got him to force him to answer. He said, well, my kids wouldn't have died. I wholeheartedly disagree. The woman that killed his kids, if she was that high on drugs and had that many DUIs and been caught that many times, if every doctor in this world didn't prescribe her drugs, she would have found them somewhere else. She would have found them on the street. She would have turned to heroin. You can't stop an addict by laws. You can't legislate an addict to stop using. So that part of I'm not saying that part of the law, but this guy's whole premise is flawed. So that tells me he's worked for 10 years because he's grasping at straws because he can't let go of his kids. And that's sad. And to write a proposition, basically he's wanting somebody to pay for his kid's death. It doesn't help anything. And
who wouldn't want someone to pay for it? But the problem is that's just not all of it, right? There's so many other elements that are not related to that. I don't have an issue with, and it didn't even sound to me, by the way, that the Vote No spokesperson, Jason, doesn't sound to me like he had a big problem with this idea of a database. He just said the way it works now, and it would go into effect the day after the vote. The way it works now, it's too flawed and it needs to be fixed. If they could fix it, I don't have a...
Too. But to say that your kids' lives would have been saved, there's no way he could say that with any sort of prediction, not any 0
of course
or 89 or any percentage in between. So it's sad.
And I do think that more addicts, I think it would stop some people. They can't get the drugs they want anymore because the doctors are onto them. But then, as we've heard so many times, these people go off the prescription drugs. They go on the street and they buy heroin. It's even cheaper. So I think you're right. Addiction is more complicated than that. Go ahead, Mary. What do you say?
I'm in a safety-sensitive job, and we have random drug testing. And the guy that just made the argument for no, he lied. Okay, number one, if you're on vacation, they are not going to call you up for random drug testing. Okay, and then when they do call you up for random drug testing, it is that random. You're not going to know you're going to be called up, and then you have a certain amount of time after you're called up to get there.
Yeah, well, I mean, they have different claims on it. He said if you look at the exact wording, there is no wiggle room on that. So, you could be 3 weeks, you could be 3 days into your family vacation, and you got 5 glasses of wine in you, and suddenly you get called up. If you don't show up within 12 hours, you're presumed to be guilty. We'll get the exact wording of that, and then we try to interpret it from there. But you got to go with the wording of the proposition. You can't go with someone's assumption about how it would function in real life. Mary George, go ahead. You're on with Bill Carroll.
Yeah, I'm pretty sensitive subject. I have a sister that is a drug seeker. She's been in the ICU on life support 6 times since January. Do you know how much it's costing the state for her to go in? And the reason for it is she has a doctor that has prescribed her 90 time-released morphine coupled with 60 oxycodone. On the same day. She was back in 2 days later.
Same doctor?
A doctor keeps
No, but it's an
prescribing.
important question. The same doctor or different doctors?
Same doctor.
Well, then a database is not going to change that. That doctor didn't need a database. He already knows what she's got.
But the point is, if you go to a drugstore to fill the prescription, she'd be in the database and they wouldn't give the prescription to her.
Yeah,
So
if the
it's
database
costing
works.
us a lot more money to have these drug seekers going in and out of the hospital, which the state is paying for.
Do you think your sister, though, if she couldn't get drugs from a doctor, you think she'd just go straight?
Oh, no, she's
or
a
would
drug seeker. But if you put her in the database and
Yeah, but what would she do, Mary, is the question. She no longer can get it from a pharmacy. What's she going to do? You think she's just going to give up drugs, or is she going to buy drugs on the street?
Well, I think the point is, I don't think that she'd be able to buy drugs on the street, to tell you the truth. I just don't.
No, I don't know.
I
I've
don't
talked
think
to a few
I
people
don't
who
think
said
that's
that
the answer at
they
all.
can find heroin
of course
within
they could
minutes.
buy drugs on the street, but
Yeah.
this particular person couldn't. This particular person's handicapped, blind, deaf, and no, she couldn't. So, I think if you have an honest doctor and you have a database, everybody stays in line. People don't get the drugs. It's a deterrent.
Thank you. Here's one guy who wrote, Bill, I'm a trucker. I only have 2 hours to report for a random or triggered drug test. I guess he's saying he's got no sympathy for doctors. I like a lot of parts of this. I'm just not sure that I could say yes when there are parts about it I don't like.